Hello, my name is Awasis Williams and this is my shoulder special test video. Ruse test. Patient would be standing or seated with 90 abducted and frontal plane of chest. Practitioner will also be standing. Procedure: open and close hands over a 3-minute period. Positive test. Any numbness due to compression, also including reproduction of symptoms. Drop arm. Patient will be standing as well as practitioner. Procedure: ask patient to raise arms above head, then slowly lower them back to the side. Positive test. Weakness of maintaining the arm position. Belly press. Patient will be standing with their hand on their stomach. Practitioner will have their hand under patient's hand. Procedure: practitioner will pull patient's hand away from stomach while patient pushes their hand into the stomach as hard as they can. Positive test. The patient will be unable to maintain pressure of examiner's hand while moving elbow forward. Speeds. Patient will be standing in front, 90-degree flexion, palms facing up. Practitioner will have hands on inner elbows of patient. Procedure: practitioner will apply a downward force while patient resists. Positive test. Inflammation or lesions to the biceps. Wall push-up. Patient will be up against the wall, hand in a diamond-shaped position. Practitioner will be behind patient. Procedure: have patient protract and retract both shoulder blades while you watch out for winging of the scapula. Positive test. If the shoulder blades move up or down during any time in the process. Aptly scratch. The patient will be standing as well as the practitioner. Procedure: have patient raise arms above head and reach the opposite shoulder while trying to touch hands. Positive test. If the patient is unable to touch hands or if their hands are far from touching. Job's empty can test. Patient will be standing, arms elevated to a 90-degree. Practitioner will be standing in front of patient. Procedure: practitioner will apply a downward direction force while patient resists. Positive test. Any pain or weakness with resistance. Adson. Patient will be seated with shoulder abducted to 30. Practitioner will be standing on test side of patient. Procedure: palpate radial pulse on wrist, asking patient to extend and turn neck towards testing shoulder. Then take deep breaths and hold it. Positive test. Marked decreased disappearance of radial pulse. Allen's test. Patient will be seated or standing with a 90-degree shoulder flexion. Practitioner will be standing on test side of patient. Procedure: palpate radial pulse on wrist, asking patient to look towards testing shoulder. Positive test. A decreased or diminished pulse. For this test, the patient will be seated and the practitioner will be standing. Procedure: have them bring their arms in so that their fists are touching. Then you're going to apply a downward force on their elbows. Positive test. Any noted pain or weakness during procedure. Hawkins Kennedy. Patient will be seated. Practitioner will place shoulder about 90 to 99 degrees. Procedure: stabilizing at elbow and wrist, internally abduct arm in a wave-like motion. Positive test. Any type of pain during process. Yergeson's. Patient will be seated with a 90-degree elbow flexion. Practitioner will be standing facing patient. Ask patient to pull towards their stomach while you resist. Positive test. Reproduced pain in the bicep. Hawkins Sign. Patient will be seated. Practitioner will be standing on the shoulder side that you are testing. Procedure: one hand over the top of shoulder while other hand grabs elbow area and pulls down a couple of times. Positive test. A positive test defined as a greater depression than a finger breadth between the lateral acromion and the head of the humerus.